Happy morning, Murali sir. Happy morning, Dhananjay.
Very good morning, all of you. Yeah. So let me introduce briefly.
Good morning to all. Very
Good
energetic
morning.
morning.
Ram Singh ji, Ram Ram.
Yeah, let us go ahead
Ram,
with our Q&A by Professor Dr. Murali, sir.
Yes, sir. Let me give a small introduction myself.
Please, sir. Please, sir. Thank you, sir.
Yeah, I am Professor Dr. Murali, the orthopedic surgeon practicing in Tumkur, a place which is 70 kilometers from Bangalore, Karnataka. I'm practicing past 20 years. So I'm orthopedic surgeon. So anything related to orthopedics, any question, I am ready to answer. If you have any other general questions regarding any health issues also, you can ask. I will try to give the answer. So in any of your health issues, whether with you or your family or the friends, whatever the health issues you're facing, you're most welcome to ask the questions. Thank you.
So that is health issues with respect to orthopedics, right?
Better. I can understand. I can give 100% answer for them. Others also okay. No, it doesn't matter. If you have other health issues, it doesn't matter. I can answer.
Wrist pain, knee pain, knee joint pain. That's a common thing. You can tell something about that.
Yeah. Okay. See, that's a knee pain is called osteoarthritis of the knee. That's basically a degenerative disorder. It's not a disease as such. It's an aging process, right? Like your hairs turn to gray and you will get cataract and your skin will get wrinkled. That's all the aging process which occurs to each and every human being, right? So similarly, the knee joint also will go for wear and tear. Okay. So as you the cartilage, articular surface which is there now, it has a regeneration capacity. Up to certain age, it will grow. After certain age, it don't grow. So if you use it, no, if you overuse it, that will go for. It's like a tire of any vehicle. If you overuse it, it will go for wear and tear. You have to change the tire, right? So frequently, 3 years, 5 years, depending on usage, you will change the tire of your car or two-wheeler, whatever it is. It's like that. So that's the once the arterial cartilage is destroyed, then the bone sits on the bone and interrupts it. That's the thing which causes the pain. That's the knee pain, osteoarthritis knee. Mandi, now we call in Canada. So that's one of the most common common complaints which we see in our my OPD regularly. There won't be any single day where I won't see any knee pain or back pain. That's the most common complaint, right?
Yes.
Yeah.
Very good.
Yeah.
Sir.
Yeah.
Sorry to interrupt. Suppose that I have the knee pain. So shall I discontinue walking or shall I continue with that?
Yes, a very good question. See, what happens, as I told you, knee pain is once again, it's an old age problem, right? So in old age, it is not only the knee problem patient will be having, you'll be having multiple problems, like your patient will be having BP, you'll have diabetes, you'll have so many other health issues. You'll have obesity also. So you need to continue the doing exercise. So what we call as mainly non-weight bearing exercise. When I say non-weight bearing exercise, those are the exercises which does not produce any weight on the knee joint, right? Suppose any exercise which you stand, if like high impact things like you are jogging, then you are running or skipping, these are called as high impact exercise.
Okay.
That will produce a lot of load on the knee joint.
Okay.
So there is one saying that joint replacement surgeons are living on the joggers of states in America and USA. So they are thriving because of the joggers, hips and knee. So if you overuse, definitely they are going to degenerate, right? So what you should do is, suppose as much as your pain permits, you can do walking. Instead of going for I've got some of my patients who say, so I go for 4 kilometers, 8 kilometers walking and all. So don't overdo it. No need to do the things. So as much as your body permits, you can go for walking, maybe 1 kilometer. If you have any pain in the knee, take a break, then you go for a walk. That's the best thing. But if you have got too much deformity, if it is grade, we call it grade 4 and grade 5 osteoarthritis, wherein it's a knee joint will be like this, it's already deformed, you cannot walk also. Even crossing a road will be a big problem. If that is the case, obviously you cannot walk. What you can do is, you can do any of those like yogasanas, then any sitting exercise, then cycling, static cycling, you know.
Sport exercise.
Yeah, static cycling. The cycling which you go on this one. That's a non-weight bearing exercise. Basically, those are the exercises like swimming, static cycling, then any yogasanas that you do by sitting posture, sleeping posture. All these are non-weight bearing exercises. These are the exercises most welcome when you have a advanced knee pain, advanced osteoarthritis. Yes. Basically, as your age advances, regeneration capacity of your body is reduced. So see that you don't overuse it, don't allow it to go for degeneration. That's the whole idea.
Right, sir. Right, sir. So you can do sport exercise, bending, knee bending, slightly bending, hand bending, waist bending. That exercises, na? Small
That you can do. No problem. Any exercises which doesn't hurt your knee joint, you do it. Sir.
Right,
That's a dictum. Yeah. Don't hurt your knee joint standing for a long time. So what we advise no patient to have knee pain. You ask them to use it as less as possible, knee joint. Like whenever you have a chance to walk, don't run. Whenever you have a chance to sit, don't stand. Whenever you have a chance to use the lift, don't go by steps. Like that.
Yes.
Basically, avoid overusing of your knee joint because they have started giving away. The degeneration has started. See, in younger ages, whatever the degeneration, they will regenerate. Whatever goes down, body will builds up in younger age. But in old age, if it goes down, it is not a position to build it up. So you see that you don't overuse it. It's like that. It's like a balance between the regeneration and degeneration. You have to balance it. That's the idea.
Waist pain?
Then?
Waist pain. Kamar ka dard.
Okay. Kamar ka dard. Waist. Okay. We call it as low back pain. See,
Yeah.
Got it. See, after a deck, the most common complaint is low back pain, backache. See, your back is the thing which is overused, underused, abused.
Right.
All kind of wrong things we do with your back, especially standing position. No, I tell you, it is a standing position which hurts your back more than the. It's the sitting posture which hurts your back more than the standing posture because when you stand, no, all the weight of your body, upper body weight is taken by the leg muscles. We call it anti-gravity muscles. Your gluteal muscles, your muscles in your buttock area, no, then thigh muscles, then calf muscles. These are the muscles which will take the body weight. So those muscles are called anti-gravity muscles, and that's why they are strong and they are bigger in size. When you are standing, all the load will be taken by those muscles. But when you are sitting, no, your leg muscles, thigh muscles are relaxed. Okay?
Yes, sir.
So the upper body weight will fall on the lower back only.
Right.
If you don't sit properly, your posture is not good, and all those situations, the load will fall on the lower back. And those are the people who are sedentary workers, like software engineers or bank employees who sit in their chair for a long time. No, those are the people who get the back pain. So most of the times, luckily, it's called what we call as mechanical back pain. That means to say because of the overuse or abuse or underuse, those are the conditions they get the back pain. That's the most common condition, like your common cold or headache. But what you have to do is you should follow the proper posture techniques. Then you have to follow. There are certain back care things like how to stand, how to sit. That's called ergonomics. There is a proper posture, proper scientific way to sit, stand, lifting the weight, all those things. If you follow all those things and you have to do certain exercises like back extension exercise. There are two exercises basically. One is your Bhujangasana, no? Bhujangasana. Those are the exercises which will strengthen your back of the muscle, back extensor. We call it extensor group of muscles. Those muscles will get strengthened by doing Bhujangasana. One more is bridging exercise.
Correct.
If you do those two exercises and take care of your back, don't overuse it, don't abuse it, then the back pain will be taken care of. And the back pain which occurs in the aging group, no old age group, that's called as lumbar spondylosis, wherein once again it's a degenerative condition. There's a lot of degeneration between the two vertebrae. There will be disc that will get protruded outside, and that will produce pressure on the nerve roots. It will produce disc prolapse. That will produce sciatica, radiating type of pain. So that's once again aging process. So if you take care of your extension exercises, if you reduce your weight and don't abuse your back, and most of this back pain can be managed without surgeries, with just few exercises and taking care of things. And there are certain specific conditions like your disc prolapse or even spine can have tuberculosis, even some management conditions are there. So there are so many other conditions which will produce back pain. So for that, we need to evaluate the patient and treat accordingly. Yes, sir.
Right, sir. Very good, sir. Thank you, sir.
Most welcome.
Sir, one question. Since you are ortho surgeon,
yes, sir.
What type of challenges we need to approach you?
So any mosquitoes
know what is ortho, we don't know. So per layman, if you wanted to visit ortho surgeon, what type of challenges needed to approach ortho?
Got you, Brahmaji. See, orthopedics means musculoskeletal system. Any problem related to muscles and skeletal system, any upper limb, lower limb pain, neck pain, back pain, Any pain. Upper limb is your any problem, right, starting from the shoulder, arm, elbow, forearm, wrist, fingers, and hand. Lower limb is anywhere from the hip joint, thigh, knee joint, your leg, ankle joint, foot. Any problems, any musculoskeletal system problem, you need to go to orthopedic surgeon, right? So similarly, neck pain, back pain, upper back pain, and any issue, basically any pain other than the chest and abdomen belongs to orthopedics, and each and every drop of blood belongs to orthopedic surgeon. That means any accidents, cut injuries, any injuries, road traffic accidents, or any fall from the height, or any whatever the fights happen between two people, no, hitting with a stone or hitting with a stake, boxing, and all those things. So we orthopedic surgeon, each and every drop belongs to orthopedic surgeon. Drop of blood belongs to orthopedic surgeon. It's like that, yeah. I think I hope I am clear in that.
Yes, sir. Thank you, sir.
Yes, sir. Yes.
Yeah. Muralidhara, sir.
Yeah.
No, one minute. Apurva madam is already raised her hand.
Yes.
Yeah, Apurva ji, good morning. Yeah.
Apurva ji.
Good morning, sir. Sir, actually, I had two questions. First one is, whenever a patient got diabetes, we ask them to have, walking.
Yeah.
But if someone went through any accident or any leg surgery, they said that they are feeling pain while walking, even for small walks. So what we can suggest them?
Yes, madam. See, basically, pain is a protective phenomena. It's a protective symptom. Wherever there is pain, you better take rest. Whether you have back pain, whatever it is, see, that's a protective phenomena. Basically, body gives, right? So the thing is that whenever a patient has undergone surgery, we have to find out what kind of surgery has undergone. There are some surgeries the patient will heal 100%, and definitely they can do all the activities. But there are certain injuries like knee joint injuries where the arterial surface is damaged. The joint surface is damaged. Though there will be some irregularity, and whenever patient walks, he will have pain. So such cases they have to avoid. Otherwise, any fracture, if you take a long bone, no, the joint surface where we call it metaphysis, otherwise the mid part is called as diaphysis of the bone, the mid part. So if there is an injury in the mid part, that doesn't affect the joints. So those patients, it will heal beautifully. The one beautiful thing with bone is that it heals by bone. That means to say, once there is a fracture, the normal bone forms, and it's a normal bone only. Nothing to worry. Some patients will have in their head, in their mind that, okay, if I have fracture, I'm lifelong disabled, lifelong I have to suffer, I have undergone surgery. Nothing like that. Obviously, nothing like that. Bone heals by bone. Suppose if the skin is cut now, that doesn't heal by skin itself. It will heal by scar tissue. There will be scar tissue in the skin forever. But bone, it is nothing like that. It heals by bone. Normal bone will get formed. And once the bone unites, is obviously normal. It is absolutely normal. He can do all the activities. Until unless there are some conditions like joint is affected, where joint has become irregular, or there is some shortening of the limb, any malleolin is there. Such condition will produce pain. Otherwise, once the fracture treatment, they are absolutely normal, as good as any other human being. Yeah.
Okay, so after 1 or 2 years, if someone got detected diabetes, we can suggest them start walking till you bear the pain, right?
Bear the pain, obviously. But once the fracture is treatment is normal. Don't think of me as a patient. See, most of the patients, what happens now, when they undergo one surgery, not only any surgery, they will put all the blame on the surgery. Suppose they have undergone a cesarean, and they will say, no, I got back pain after cesarean, this problem has started, this problem has started. After surgery, my life is ruined. I've undergone so many surgeries, one for appendix, 2 children, a gallbladder, so my body has become totally weak. Nothing like that. The blood is regenerated, the tissues will heal up very fast. They're absolutely normal. They have the problem only in their mind.
Okay.
So whatever the sickness, feeling, it will be there. Not post-operative periods, for some duration, it will be there. There's some amount of blood loss, they'll give blood transfusion also. Some amount of recovery time will be there. But antibiotic, painkillers, although some kind of sickness feeling, some time regenerate of the body to regenerate, it will take some time. So after that, once the patient, because they're quite normal, other than a scar on the skin, nothing is, everything will be normal. So until they have that in mind that we have become weak, blood has gone, all those things. That's more of a psychological issue, I feel. Yeah.
Okay.
Muralidhara sir, I had a question.
Yeah, please.
When a person who's feeling the pain in the walking, they can do swimming or water exercises and all to build the strength.
Exactly. That's what I told you.
Now a lot of air walkers. I have one with me. which puts no stress on the joint. It's like swimming. So basically you want to, and then strengthening also, you have to strengthen the quads and the hamstring.
Exactly.
Go back, simple physiotherapy. And walking is something everybody will be able to do, according to me. Eventually. You have to listen to your body.
Yes. That's what those exercises called as non-weight bearing or non-impacting exercise.
Low impact.
Non-load bearing exercise basically. So your knee joint is not stressed. Hip joint and knee joint being a major weight bearing joints of the body, those are the joints which take maximum stress while walking, skipping, running, all those things. So if you do those exercises where weight is not borne, like swimming, then cycling, whatever you are doing, those exercises definitely they can do it.
In fact, water physiotherapy is really coming up a lot.
Yeah.
Physiotherapy in water. You have physiotherapists we have a place in Mumbai where physiotherapists are swimming in the water with you and helping you to build your muscles because there is no stress. You're literally floating.
That's what, madam. That's called a buoyancy effect.
Right. Your
body weight will significantly get reduced. So joints will be much more, muscles will be doing the exercise very easily. So that effect will be there. So they can do the exercise very easily, comfortably without having much load or problem. That's
another thing also I wanted to check with you. I tell some of my clients who have plantar fasciitis, that is when the sole of the foot side, there is a sponge, there is a walking sponge. You get a thick sponge on which you can just gently walk just for 1 or 2 minutes several times a day. So before you feel tired, before you feel the pain, there is that air sponge, you feel like you're on air. That also can be done at home. So people, according to me, don't have to walk for 30 minutes. They can even just whatever, shy of pain as we call it, couple of minutes, they can walk 10 times a day. Every 30 minutes, walk for 2 minutes.
Yeah. So plantar fasciitis is basically heel pain. There's what is called as a structure called as plantar fascia.
Yeah.
And once it's get inflamed, that patient will get the pain because of long-standing, a lot of pain, of course. Long-standing people like professionals like your traffic police, then teachers will, and even housewives who have to stand for 2 hours, 3 hours worth of booking. And most of the work is done in the standing portion only. So those patients who are obese and patients who are diabetic and patients who are joggers, these are the patients will more commonly get that plantar fasciitis problem. So basically you need to take adequate rest and do some stretching as suggested, take some physiotherapy. Most of the people will do well with my course of analgesics. If they're not improved, we can give a local injection also. And recently, recent therapy called as PRP, platelet-rich plasma, has come, and that also giving good results. Yeah.
Yeah. Muralidhara sir.
Yeah.
Yeah. Nowadays, more problem we are facing, we're seeing that the neck problem. The people are this neck band roll around neck. So how to avoid it before it happens? Yes, spondylitis. Yeah.
Yeah, cervical spondylosis. That's once again a degeneration condition, sir. So especially because of using computers and we call as this is the normal. I will tell you some preventive things that you can take care so that your neck will not get strained. See, this is called as normal anatomical position. Okay, any organ in the body, whenever it's a normal anatomical position, that is the best way it will function. That's the best posture, right? Called as normal anatomical scientific posture, right? So this is the normal posture. Suppose if you're bending like this, too much of stress on this part of the muscles, right? Or if you doing like this, then a lot of stress here, the muscles here got stretched, okay? Or whenever you're sleeping, no, the pillow size should be the thickness of whatever the gap is there from ear to ear. It will vary from person to person. Suppose if you're using a too thin pillow, your neck will go like this. If you're using if you use double pillows, if you're thicker pillows, then it will push like this. So all these are non-anatomical and painful postures. So whenever you see a computer, it should be at a higher eye level, and you shouldn't look down, or you shouldn't look up, or you shouldn't look left side. So it should be normal anatomical posture. Whatever the work, wherever it is, not only with your head and neck, whether it's a back or whether knee joint. So see that the body parts are maintained in normal anatomical position. That is the position where they can do maximum function without much hurting, without going for much degeneration. So those are the things which you have to maintain, normal long-term position. Then you can do some exercise to strengthen your neck muscles. Basically, these degenerative changes will occur whenever, see, that's a fatigue, like what we call as RSA, repeated stress injuries. Suppose if you're overusing any part of the body, I'll give one good example. Between Tumkur and Bangalore, there's a toll, right? So they have got 6 hours shift. I've got several patients from that toll. I will ask one question. Per shift 6 hours, Dhananjay sir, you tell me for how many times you would have lifted his shoulder?
Oh,
You just take a guess.
6 hours, na?
Yeah.
I think 6.
The person who sits in the toll, no?
500
How many times you will lift his shoulder?
500 times.
Not
Maybe
even-
for giving the cash or maybe collecting.
For each vehicle, he has to
Yes.
lift twice.
Yes.
Minimum, he has to lift for 4,000 to 5,000 times.
Oh,
Yeah.
too much.
Every day is doing that. How it is possible? Not, it definitely shoulder will get paid.
Yes.
Every minute, so many vehicles are passing. He has to collect the thing. You have to give it back. He's keep doing these movements. Yeah.
2 times, yes.
Yes. So our body, see, your anatomy is, as is your anatomy, so is your physiology, or vice versa. As is your physiology, so will be your anatomy. So your body parts has different functions. It has been manufactured like that. You cannot overdo things. Like suppose if you overdo your fridge, it will go for burn. If you overdo your mixie, if you overeat any pump, if you do overwork, it will go for burn. Similarly, burnt out syndrome will happen with your body also. You cannot overuse things. You can take breaks in between, and you have to maintain the things also. So for neck, you should do what is called as neck strengthening exercise, stretching exercise. So these are the neck muscles, especially the paraspinal muscles. These are the muscles which maintain the posture of the head and neck. See, even your brain and skull, which has around 10 to 12 kgs of weight. So your neck muscles has to be strong enough to take that weight of the head and neck. Okay. So to strengthen those muscles, simple exercise like bending, pushing the head forward like this to strengthen, then pushing it backwards, then sidewards like this on both the sides, then shrugging exercise and leaving it. These are the exercises which will strengthen all the muscles on and around the head and neck. If you do those exercises, the muscles will be strengthened basically. Then the head and neck posture, weight and other stress and strain will be taken by the muscles. See, whenever you got a strong muscle, that's why in young individuals, whatever they do fighting, they do jump, logging, all those things they'll do kids. So muscles are quite strong and they're much more elastic. They're in the position to take the much more stress and strain. But as the age advances, the elasticity, the capacity, all those of the muscles will gradually it will go down. So that's the time when if muscles are not strong enough to take the load of the whatever the stress and strain you give. Then what happens? The ligaments, the soft tissue, the capsule, the bones, those things will start bearing the brunt of the injuries. Then the real problem starts. So that's why there's called as degenerating aging process disorders. So you need to do some exercise to strengthen your muscles all over the body. It need not be only in the neck portion, neck or back, any kind of muscles. If you strengthen your muscles, naturally the pain will come down. Yeah.
Any way to make the cartilage again
Growing, is it? You mean growing of the cartilage?
Hey, we can regenerate cartilage.
Yeah, yes, madam. Unlike bone, cartilage regrowth is not that very not considered not very. It doesn't usually occur. What happens is in younger age the regeneration occurs naturally, but as there are some, if you go to cellular level of the biological cellular level, each and every cell has its own potential to regrow. To certain extent, it will regrow. After that, it will not regrow, right? So younger age, the regeneration of the cartilage will occur, but as the age advances, that regeneration will not occur to such an extent. So that's why we have some of drugs like your chondroitin sulfate, glucosamine sulfate, you call as MSM. Those are the substances which are basically needed for the growth of the cartilage. So in younger, in early stages of the osteoarthritis, where there is only minimal erosion of the joint surface, we do prescribe some medication which contains these kind of things which will help in the regrowth of the cartilage. They're basically building blocks which help in the growth of the cartilage, like your chondroitin sulfate, glucosamine sulfate, all those things. So in initial stage of the osteoarthritis, they definitely do help. but they need to be taken for a longer period, like 1 month, 2 months, 3 months, sometimes even 6 months also. So in early stage of the disease, if you take those kind of drugs, that will help in the regrowth of the cartilage. And if you do exercises and if you do good exercise, that will also increase the blood flow. That's why we tell you have to do the exercise to keep the range of motion of any joint. And if you do proper exercise, there will be proper blood flow to that particular joint and joint surface. And that will also to some extent help in the regrowth also, as a body as such. And you can give extra supplementation also. But if the patient
can I share something? I've had 90% tears, one in my ACL and one in the rotator cuff.
Okay.
And with very, very simple weight training, I have taken an MRI again, and the tears have been filled up.
Wow.
And this happened when I was in my 50s.
Okay. Soft tissues have ability to regrow, madam.
Sorry?
Soft tissues, no?
ACL ligament and this rotator cuff also, some supraspinatus something.
Supraspinatus tear will be there. So there are varieties of tears. Some tears will heal up, some tears won't heal up. Depends on the patient and kind of
the
tear.
thing is, what I learned was that you have to always be working out, because then suddenly if you get an injury, you can't start new exercises. So you have to have muscle memory for being somebody who does regular, physical activity. And then with light loading, working out, just very, very shy of pain. So if this is the range that was the exercise, I would only do so much, slowly went up. And of course, it is, my doctor also was surprised with, because rotator cuff, you can't take the hand up and down, but I can. This is where I had it. It's the same, both sides. And it happened in 1 month, within 1 month. So, with the human body, I've learned it's so amazing. There's always a way out if you look for it.
Yeah.
If you keep active, the body is meant to heal us. It is designed to heal us.
Yeah, especially
Yeah, the only thing is the kind of lifestyle we need, we cannot get into that. So the idea is to always have an active lifestyle.
Yeah, especially with musculoskeletal system, the more you use, the more exercise you give, they will be in better shape. Yeah, especially with rotator cuff, there is some insignificant tears sometimes. Your MRI can't so much rely on that, because basically it's a few signals here and there. Right. So if you strengthen some muscles around the shoulder, then also you can lift. Even though there's strength, then also you can.
There is something else that compensates whatever.
Yeah, exactly. Your shoulder muscles, they will compensate, and they will start working. They will take the load. So you can start doing. But ACL ligament, if it is complete tear, it won't heal, madam.
But my MRI showed that.
No, I told you, no. See, ACL means there is a ligament which is like this. If it is part apart, it cannot heal. It will be just floating around in the knee joint.
No, I think it was a 90% tear or whatever.
Yeah, suppose if there is some contact.
Functionality of the joint is there. Functionality of the joint is there, about 90%, 95%. No buckling of the knee, none of all that. I'm not experiencing all that.
Exactly. That's what is called as ACL dependent, ACL independent knees. Some patient, even with ACL tear, they're fine. Yuvraj Singh, the cricketer, he has got complete tear and he does all the things. He has not undergone any surgery.
Wonderful.
Yeah, he has got undergone physiotherapy, he does exercise. There are sports people, they do exercise regularly. And the ACL tear, all ACL tear doesn't need surgery.
That is the key. If you are regularly exercising, even if you have an injury, it is not that.
You'll recover very fast, and your compensatory mechanism basically will be of good in this one.
So the recovery, how quickly you recover is you have to be a talented recoverer of injuries. You have to build talent around that.
Yeah. The patient part also plays very important in the recovery, more than the surgeon part and treatment part. Yeah.
I think we'll take up Dr. Murali, Professor Dr. Murali sir next session. Thank you, Murali sir, for the lot of information.
Questions. Can I ask?
Madam, now fitness coach Madhuri madam will give 5 minutes. Then next session we'll definitely ask madam. Next session we'll conduct once again Professor Murali sir.
Thank you so much, sir. Thank you so much.
No problem. Any number of questions, any number of questions, any number of sessions is okay with me, sir. Any kind of questions is okay with me. Anytime, no problem.
Thank you, sir. Thank you.
Thank you so much for the opportunity.
Yeah. So since I had prepared a half an hour video, but presentation, but I'll do that next time because that has a whole structure to it. Now, taking forward what Muralidhara sir has been talking about, he spoke about being in the right anatomical posture. So a simple way to do that is how we do it in Pilates, is to see that when you stand, your ear is always over your shoulder. The shoulder is always over your hip. The hip is always over your knee, and your knee is always over your ankle. Let me repeat that. I need permission to record, sir.
90 degrees.
Okay. Record on this computer. Okay, so that's the important thing, is to get your ears over your shoulder, shoulder over your hip, hip over your knees, and knees over your ankle. So when you look sideways in the mirror, when you look sideways, you should be able to see even now when I'm sitting, because of a lot of computer work, my ear is slightly forward. So, I have to try to bring it back. If I keep my ear over my shoulder, automatically I feel a difference, in my back. And then your body weight is more on your heels than it is on your toes. Am I right? Your body weight is on your heels rather than on your toes. And that allows the body to be in perfect alignment. And that way, then what happens is that, like Muralidhara sir very nicely explained, that the wear and tear and the friction between the bones and the joints, the vertebrae, and all of the joints is reduced, largely reduced, as a result of which there is a lot of nutrients and blood flow that can come into the body easily, especially in between the vertebral discs. And when there is enough nutrients and oxygen coming in, then automatically the healing happens, as the wear and tear is less and the healing is more. And so then you get into the zone of being pain-free and a lot more functional. So we have to try to always, so there's a little small exercise. I mean, I can teach you. Of course, these were all the strengthening exercises. The other is the chin tuck. There is a chin tuck, right? So we need to put our chin, just put 2 fingers on your chin like this and just push it at the back. Parallel, right? So inhale, exhale. Yeah. So you can do about 5 to 10 of these every 30 minutes that you sit on the computer. You can stretch completely. Now, when you stretch, people bend everything. You should only just drop your neck, do this, strengthening here, and do a chin tuck. And that way, again, you're going to release a lot of tension, a lot of the stress that is accumulating at the back, causing cervical spondylosis and those kinds of things. So, this brings me to the next concept of people. More and more research is pointing to the fact that you need to exercise in small bursts throughout the day. You need to be active in small bursts throughout the day just to prevent this repetitive stress injury. Now, it was, totally mind-blowing and very, very insightful to know that the tall person has to use his shoulder so many times. But when we sit for hours on end on the computer, our spine and our hip is totally frozen, stiff in one posture for so many hours. That also is repetitive stress injury. Am I right, sir? If you're just sitting and being stiff in one position, whether you're sitting any posture, if you sit for more than 30 minutes, whether you're standing, sitting, anything, slouching on the couch and watching television, that posture is causing a lot of back pain, So I think these postures, you have to break, you have to do the Pomodoro technique, in the sense that you, on the computer for 25 minutes, 5 minutes, just move around, do anything. You don't need any exercise routine or anything, whatever helps you to feel completely mobilized. So you can take a 5-minute exercise snack or a 2-minute exercise snack, come back. So accumulate your exercise snacks from 2 minutes to, a few minutes every time you sit in front of the computer. Neck, of course, is very important because you can literally feel the neck is very, very important because it houses what? What is there in our skull? Our brain, right? So, keeping our neck free and
logical system.
Exactly. So that way, then, the shoulder stretches and all these things really, really help. So exercise snacking has become much more important than having one big exercise in the morning and then being inactive throughout the day. People go to the gym, they exercise for 1 hour. People go for a yoga class, they do exercise for 1 hour, and then they feel that throughout the day, they can just keep sitting and doing nothing. So those things are not, that is how it has to change. So these are my, suggestions right now. So, keep the mobility when you, see, there is a statement that says motion is lotion. When you move, it's a lotion inside your body. Just think about that. Every 30 minutes, get up, do something, small thing, come back and start again and keep, twisting, moving your neck. Don't allow the body to stiffen up or keep on doing a repeated action over and over again. And ears over shoulder, shoulder over hip, hip over knee, knee over ankle. And what you can all do is take a side profile picture of your posture. And if you want, you can always post it. And, we can take 1 or 2 people who are willing to post their posture and look at where it is off and help you to become aware of where your posture is off so you can start correcting it. First step is the awareness. Yeah. So I will, I had a half an hour presentation prepared. I will do that, whenever next time or the time after that. Very interesting research on exercise, how important low impact exercise is more than high impact. We think that we have to go all out. You don't have to. In fact, research is proving the other way around. So I wanted to share all that with you. So I'll do that the next time. In the meantime, I have also any questions? Any questions?
Madam, one clarification actually.
Sure.
RSI means repeated stress injuries.
Right.
When you do the same activities repeatedly, there will be stress injury.
Right.
What I tell my patients, it's like we in Kannada one saying is there. Magu malkoli anta total togadu, ame madal gindadu anta. Satyasai can understand that. So it's like a small child will put him in the cradle and we'll start swaying it so that it will sleep. Once it sleeps, we'll pinch it so that it will start crying once again. Once again we'll do it, once again we'll pinch it.
Exactly. Yeah.
It's like that. So if you don't give proper rest, then the injuries will reoccur. That's why it's called repeated stress injuries.
Right.
Sitting for long time doesn't cause any RSI. RSI means like you suppose I will give a good example.
Okay.
Yes, Sachin Tendulkar, he has to play for a long time, long duration.
Same repeated action over and over again.
Yes, his bat used to be very heavy, and that's why he got the tennis elbow.
Okay. Yeah, because all the time
repeatedly overusing it. Yes, overusing it.
But the thing is that when you sit for long, you get stiff. Maybe you get
stiffness is there. That doesn't cause any injury. Stiffness is there. It's not an injury, basically.
It's not an injury. Okay, but that's stiffness kind of makes the back tight, and then you don't feel like walking. And
yes, that
so
will be there.
Have some mobility to remove the stiffness. And
but that's not RSI. That's not RSI.
Okay.
There should be injuries. Yeah.
Yeah, I stand corrected. That's fine. Yeah.
Yeah.
Okay.
Like Tendulkar, like the person who was in the toll.
Yeah. Okay. Great. Right. So I also wanted, my website, madhuriruia.com, new one is out. And if all of you can, I'll share if you can have a look at it and, tell me how well it is, how ease of operation, because I'm still tweaking it. So let me know, what you guys think. I would love to know your views. And yeah, I guess that's it from me for today. It's already 8 o'clock on the dot. And thank you so much, everyone.
Thank you, madam. Thank you, Professor
Thank you.
Murali, sir.
Wonderful. Thank
Madhuri,
you,
madam.
both of you,
Thank you,
Murali
sir.
sir and
Madhuri ji.
Madhuri ma'am. Yeah, Madhuri ji, all. both of
Welcome.
you.
Have a very healthy Motion is Lotion week.
Motion is lotion. Yeah.
Yeah. Okay.